is tomosynthesis really finding these additional areas of distortion? Well, I think what we certainly recognize is when you're really cutting the breast slice by slice, you are really seeing those elements of breast tissue more clearly. And really, on the 2D images, sometimes we weren't appreciating these previous areas of scar. I know myself, when I often ask a patient, do you remember that you had a breast surgery? Oh, I think I remember, but oftentimes they don't remember which breast, how long ago it was. And so it becomes very important that we document and be consistent year to year, that we know exactly where the patient had the surgery or lesion removed before, and where that translates into what we're seeing now on our tomosynthesis images. Can we use scar markers to help with these challenges? And really, what are the challenges we face in terms of reading through these images for our patients? Can it make it easier for the radiologist who is reading the mammogram? And some of you out there may be doing only breast, and so you're very comfortable reading mammograms because that's all you do all day. There are some radiologists, however, that read mammograms one day, they may read other modalities another day. So again, making it easier for the radiologist so that they're better able to quickly find lesions and to quickly dismiss areas that maybe aren't significant is really helpful for the radiologist. Also, the other thing that's important is you may be reading mammograms off-site. In other words, a technologist may be in a different area performing a screening mammogram, and then you read the images maybe the next day or later that day. Sometimes you don't have that direct face-to-face contact with the technologist. So anything that makes it easier for the technologist to communicate to you exactly what sort of surgery the patient has had, what sort of problems the patient may be experiencing, is better for you as the end reader, trying to figure out if there's really a problem with that patient or whether it's just traditional marking, say from surgery, that sort of thing. Also better for the patient, because at the end of the day, again, what are we here for? We're all here for our patients. We all are here doing our breast work because we care about our patients and we want to give them the best result.